Morning, everybody. Welcome to Family, Seniors, and Health Committee. We have two bills we're going to be hearing. Senate Bill 861, sponsored by Senator Moon. Senate Bill 999, sponsored by Senator Hudson. Mr. Secretary, please call the roll.
Senator Bratton. Senator Nicola.
Here.
Senator Hudson.
Here.
Senator Lewis. Senator Nurnberg. Senator Carter.
Have not established a quorum yet, but we can begin. Senator Moon, would you like to begin and present your bill? Doesn't look like we'll have a time issue right now, so if you could stay under an hour, I'd appreciate it.
Good morning, Mr. Chair and committee. Thank you for allowing me to present Senate Bill 861 this morning. And as many of us know, and likely many were here when we passed the SAFE Act a few years ago, there is a sunset, and it will expire next year in 2027. And I believe it's important for us to consider the ramifications of allowing this sunset to expire or to continue. I remember the first person I actually met who had gone through a surgery to change their appearance, because that's really all it was just an appearance change. Her name was Kelly King. She came to my office, sat down, and we had a pretty long and thorough discussion about what she had done years before. I believe she was now 50. She said that she just didn't feel comfortable in her body, and she thought that perhaps changing to a more masculine appearance would be something that would solve her dysphoria as we have come to know it. She pulled up her sleeve and showed me a scar that was made when some skin was removed to form a penis. And all that did, it was just an outward appearance change. She had her breast removed, and then she dressed like a man, and I didn't know her before, but she apparently acted like a man as well. She had children. She had her daughter, one of her daughters, with her. And she explained to me that day that what she had done caused so much physical harm and quite a bit of mental harm as well, because what she thought she needed to do didn't solve the problem that she thought she had. She had accumulated, at that time she told me, $1 million in medical expenses. And how in the world can you pay that? I mean, that's just an astronomical figure, especially when you're looking for a resolution to a problem which didn't occur. Then, about a year later, I met another young woman. Her name was Chloe Cole. She came to my office with a friend that she had made, Luca Hine. And Chloe told me that when she was about 12 years old, she was a happy kid. She participated in rough and tumble activities with her friends, mostly boys. But she looked in the mirror one day and compared what she saw with some magazines portraying young girls about her age, and she said to herself, that's odd. I must not really be a girl, because she dressed like a boy, she kept her hair like a boy, and so she was troubled. She went to her parents and explained the situation, and they didn't know how to help her. So I don't know if it was the wisest thing, but they took her to a medical professional. And this doctor told the parents that they needed to continue what Chloe was thinking, just to affirm her and let her know that maybe she's not in the right body. And so it was when she was 12, the medical professionals thought it was wise to start her on some hormone treatments. And these hormone treatments were intended to help her to transition from a male body to a female body. And I think we know, if we actually believe in science, this is not possible. It's not possible to transform a man into a woman or a woman into a man. And so this continued, these treatments continued until she was about 13 or 14, I believe it was, she told me. And then a physician convinced her and her parents to mutilate her body, to remove her breast. And so they did. And then fast forward to a couple of years ago when she was in my office, she said, you know, I don't know if I'll ever be able to have children because of all the chemicals they've injected into my body. But I know one thing for sure. She said, I'll never be able to breastfeed a baby. And she was heartbroken. When Luca and Chloe were in my office, if I had not known their voices before, if I turned my head as they spoke, I would have thought they were males because of the hormone treatments had changed their voices. And I bring Chloe and Luca up because before I met them, and even continuing today, I know Luca is most prominent on social media, but she is trying to convince kids not to go through those procedures. And I say, I agree, mostly because of the harm. The medical community is supposed to treat people, to solve problems, not to exacerbate problems, not to go against the science that we have known for years, and then purport that something else can be done that's anti-science and anti-nature. And Chloe is trying to convince kids just to be kids, to grow up, because what she has found and what others have also experienced is that if you just live and not make those changes that have been horrific in Kelly's experience and also Chloe and Luca's, that they will outgrow that. But yet we've had parents think that they are going to support their child's decisions because they want them to be well. And I agree. I think they are thinking right. But mutilating and poisoning is not the way to do it. And so I'm hopeful that the committee will see the logic in this, that when a child grows to be the age of majority, which in Missouri it's 18, they can make any decision they want to make. And if it's mutilating their body, making changes, and their burden, paying the cost of it, then that's their decision. But it shouldn't be something that taxpayers should be paying for, nor should it be something that the medical community is supporting and purporting as an answer to a problem that is primarily in their minds.
Senator, thank you so much for bringing this bill to the committee. Appreciate it. Quorum has been established for the record. Anyone on the committee have questions for the senator? Senator Lewis?
Thank you. Good morning, Senator.
Good morning.
Got quite a few questions. So I guess I'll just start with, you talked about the medical community mutilating, poisoning children. Have you spoken with any physicians in the state of Missouri about this issue?
I've heard their testimony. I have not questioned them, but I have heard from Jamie Reed, who was in the medical community that was actually doing those things and harming the kids. And she presented an affidavit when she testified for the bill. And if you read that affidavit, you'll find that those who are doing these things to the kids are actually harming them in more ways than one. And Jamie said that she can no longer participate in that activity.
Right, I'm familiar with her, but so you haven't spoke with any physicians. Jamie's not a physician.
Mm-hmm.
I just want to be clear with the
I've just heard their testimonies.
Okay.
I have not spoken to them, yes.
Okay, thank you, Senator.
You're welcome.
Also, a question about, you started your opening remarks in talking about this is just simply appearance changes. So what are your thoughts on other medical conditions, like if somebody has a deviated septum, has sleep apnea, needs a rhinoplasty or nose job that would change their appearance? Are you opposing that type of surgery?
Deviated septums don't change your appearance.
If you get a rhinoplasty or a nose job to
But
do that,
if it's something that I could have a tattoo on my hand, that would change my appearance.
Yeah.
Yes, I'm not against procedures that are cosmetic. However, when you have a child who is under the age of majority and who hasn't fully developed physically or mentally and emotionally, and you are saying that this is going to solve a problem that has been created in their minds and perpetuated by adults who should know better, I'm against it. And you can look, Senator, at some individuals who have had these procedures done on them, and you will likely find that it hasn't helped their condition.
Okay, and then Senator, I'm just wanting to be clear with the intent of this bill and the way I've read it. You said you're banning this for children, but the way I read this includes adults as well.
No, I didn't say banning. I didn't use the word banning at
Okay.
all. I'm just saying we're removing the sunset on the bill for the SAFE Act that was passed a few years ago, and it is currently the law in Missouri.
Okay, and then do you believe in parental rights?
Absolutely, I do. But there's a difference when a parent is caring and nurturing their child and participating in what could be deemed as an abuse of a child. And Senator, if you would just talk to some of these adults who have done this, even as an adult, and they're coming to us and urging us not to continue allowing this practice on minor children, I think you would probably be convinced and your mind might be changed. I hope it would be. Then if you talk to individuals who had these procedures done as children on them and they're no more happy than they were as children, and now they're physically changed and harmed, I think we need to let these kids grow up and then as an adult make the decision. Now, some adults will make it. This is not banning adults going through these procedures. And so I'm just hopeful that we will truly care for children under our authority in Missouri and say we're not going to allow abuse, mutilation of their bodies as long as we're sitting in the seats we're sitting in.
Yeah, Senator, well, I certainly do not support abuse for children or abuse for anybody or domestic violence or any of the horrific things that happen.
Right.
So just want to be clear. I wish that we were actually talking about real issues that impact when several of our constituents, we're in the health committee, can't afford health care. And, I wish we were addressing things to increase access and remove barriers, as several counties in the state of Missouri are considered healthcare deserts, but here we are talking about, maybe a handful of people that have had bad experiences, because I've talked to other folks who have different experiences. So thank you, Senator.
You're welcome. And Mr. Chair, if I might just make a brief remark on that. These procedures have been purported to be health care. And when you're cutting off body parts and cosmetically adding body parts that have no function, and I know adults do that for, plastic surgery procedures, and that's a different story. But when you're doing this to a child who has not been fully developed, and they're not able to make decisions that would have long-term lasting effects, this is abuse, and it must continue to be stopped. It's stopped now. We should not allow these practices to be started again on children.
Thank you, Senator. Senator Bratton?
Thank you, Mr. Chairman. I have to get to a bill presentation, but I wanted to thank you for bringing this forward. I hate the fact that we're having to revisit this. I wish we could have just got a complete ban and forever and ever, not to have to come and revisit this. But as a father of 5, getting ready to be a grandfather, you know, it's amazing when you bring up a child. My son is 16 years old today, my youngest son. So he's probably doing his driving test right now. But I'll never forget, you know, from the age of about 3 years old up till about 6 years old, the kid thought he was Batman. I mean, like, there was nothing you could do to get his mind off. I mean, he woke up and put on his little Batman mask. And everywhere he went, he had his Batman cape, and he literally thought he was Batman.
Mm-hmm.
But I, you know, you play along and you allow that, and you allow, you know, but you don't embody that. I didn't go and surgically attach a Batman mask to his face. And kids are so easily manipulated in today's world, and the capability to be able to abuse that, the naivety of a child, and they believe that these parents and these so-called professionals are in these places for their best interest, but as we're seeing in these shop of horrors like Jamie Reed has put out, it's not. Their best intention isn't really for the betterment of children, and I hate to say it's for the fact of the the never-ending need for medical treatment from these shops of horrors. They will always need something from the medical community. Mm-hmm. You know, we bring up the rhinoplasty. Rhinoplasty is fixing a potential defect in the nasal cavity or whatnot. Removing breasts that are perfectly functioning is not rhinoplasty.
Right.
Removing, you know, a penis is not a normal procedure. And the fact that we're injecting castrating chemicals that they utilize for offenders and we're injecting these into children is abuse. We just celebrated the Holocaust Remembrance Day yesterday, and the most dangerous people in Germany weren't people in uniform, they were people in white lab coats.
Yeah.
And to say that is not happening to these kids, and we stand idly by and say it's their choice, it's egregious. You can't change who you are, and it's unfortunate that these kids are manipulated and the social contagion is allowed to happen and it's popular. Well, now we're seeing that the trend is actually reverting back to normalcy. These kids do need help, but it's not in surgery, and it's not in a chemical being injected or ingested into their bodies for permanent damage. And that's exactly what this is, protecting that innocence. Yes, kids are confused. Kids have the capability to be manipulated by society. They see it on TikTok. They see it as cool, and it's accepted. So therefore, you know, they in their I guess questioning mindset are willing to go down a road that unfortunately in Miss Cole's case can never go back. And if they want to do this, once they go through the natural processes of puberty and of life, and as adults want to make those decisions, then so be it. You know, would you ever allow, if a kid came to you and said, I want to put a big giant tattoo on my face, you would be charged with child abuse if you let your kid tattoo their face entirely. Because just because the kid wanted to put a tattoo on their face didn't mean that they knew really exactly what they were doing. Well, this is much graver and much more dangerous than a tattoo on your face. So I just wanted to thank you for bringing this forward. We've got to stop placating this. I think these doctors need to be in orange jumpsuits, not in white lab coats. So thank you.
Welcome.
Senator Hudson.
Thank you, Mr. Chair. Thank you, Senator, for being here today. I appreciate this piece of legislation. You'll remember that you and I worked together on the SAFE Act. I appreciate all the times that you allowed me to spend with you and your office and others as we went over the legislation that we were working on and getting it across the finish line. And here we are. The sunset is about to expire, as you said, next year. So I think it's very important, and I know this has already been stated, but I guess I want to kind of restate it. What you're trying to do here is really pretty simple. You want to take law that has already gone through both houses of the legislature. It's already been signed by the governor. It is the law of the land in Missouri. And you want to remove a sunset from a portion of that law, correct?
That's right.
This law not only has gone through the legislature and been signed by the governor, but has been challenged in the judicial branch on more than one occasion and upheld. First law of its kind in the entire country to be challenged and upheld as such. I'm proud of the work that you and I did together on the SAFE Act, Senator. It will always be one of the highlights of my legislative career to have had the opportunity to protect kids from sex change, drugs, and surgeries. Sex changes and little kids are two things that should never go together. Now, when we worked together on this, I was in the House. You were here in the Senate. I was in the House at that time. And a lot of the sunset conversation I was not involved in because it was a conversation that was taking place on this side of the building. Of course, I don't think I don't want to put words in your mouth, but I know we had conversations, and I was certainly not a fan of the sunset. As a matter of fact, the House bill, I was the handler of your Senate Bill 49. Was honored to do that. The House bill that I had moving at the time was House Bill 419, if memory serves. This is in 2023. And there was no sunset on that House bill. We got it over to the Senate out of the House, but leadership at that time basically said, it's Senate Bill 49 or it's nothing. And so seeing that that was going to happen, I was honored to be the one to make the motion to send it to the governor. But it's my understanding that in the conversations that were taking place on this side of the building, there were things said such as, well, let's give it a few years to see if there are new discoveries or see if we learn something more about how this may be necessary. Senator, I have, and I'm sure you have as well, really kept an eye on this issue. And I have seen absolutely no evidence that portion of the bill that we worked so hard on and that had gone through the legislature and the governor's office and been challenged in court should go away. I've seen no evidence of that. If anything, the evidence that I've seen points to being in favor of removing the sunset. And you would agree with me?
I agree.
Well, fully behind you in this effort. I want to do everything that I can to help make sure that we protect kids. Thank you for bringing this forward.
And just for the record, Senator, I almost called you representative, but that's when we worked together on this. You were a representative, now you're a senator, and I'm grateful that you wanted to be a part of it, and you were so humble in your attitude, and so I'm grateful that now I think you have a similar bill as well, and either one, whichever one passes, I'd be happy with. So I'm grateful to you for all the work you've done on it.
Thank you, Senator. And for those that may not know, you and I had a conversation very similar in 2023, and we both agreed it doesn't matter whose name is on it. We just need to get this across the finish line, and we feel the same way about removing the sunset.
Right.
Thank you.
You're welcome.
Thank you,
Mr. Chair.
Appreciate it. We'll begin with testimony for those who are in favor. There will be a 5-minute time limit, so those who are in favor, please come up. Seeing one.
I'm just going to go on record in support of removing the sunset. I'm sorry. Go ahead and sit down. Bev Valen with Liberty Link, Missouri, and just want to go on record as being in support of taking out the sunset clause of the SAFE Act. But I was back there. I was thinking about this new discovery. When I was laying around for a couple of months with my hip problem, I discovered Reels, Facebook Reels, and her name is, I don't even, I'm a big picture person, Lex Rennick. She lived as a man for, I don't even know, I should know how many years because I've watched so many of her videos. And, but she was living as a man. She had top surgery. And she was living with another individual, a male who was living as a homosexual at that time. But they found Jesus, and they have a biblical marriage, and they have 3 children. At that time, there's 3 children under 3. I don't know how old the kids are now. But anyway, we have a lot of chaos in our society, but the answer is Jesus. Thank you.
Thank you for your testimony. Any questions for the witness? Seeing none, thank you very much. Next, in favor. In favor. Seeing none. Those who are against, 5-minute time limit.
Good morning.
Good morning. Can you make sure your mic's on? I'm sorry. Yeah.
I think I'm
perfect.
on now.
Yes, you are.
Thank you. My name is Dr. Katie Hayden-Roots. I'm a licensed marital and family therapist. I'm a certified sex therapist and a faculty researcher with over 11 years of experience working with adolescents and their families in Missouri, including those who are trans and gender diverse. I live in Rock Hill, Missouri. I'm a mom, but not a mom to a trans kid. I'm here to strongly oppose SB861. SB861 would prohibit needed and new prescriptions for puberty blockers and cross-sex hormones for minors, allow legal action against providers, and restrict public funding for gender-affirming care. These measures threaten the health, safety, and well-being of vulnerable youth, something I have seen firsthand since 2023 when the original bill passed restricting gender-affirming care for minors in Missouri. Leading and credible medical and mental health organizations, as you all probably know, support gender-affirming care for minors when clinically appropriate. Longitudinal and empirical research studies continue to be published and empirically reviewed, showing that gender-affirming care improves mental health and reduces the risk of suicide for trans youth. This new bill replaces individualized expert clinical judgment with a blanket prohibition contrary to best practice guidelines. Ethical principles in medicine and mental health emphasize the first, do no harm, yet this bill prioritizes ideology over patient well-being. I've walked alongside dozens of families with trans youth, and many, but not all, sought medical intervention for supporting gender transition. I'm sitting here today with you all instead of my much warmer, more comfortable office because of their stories that I witnessed firsthand, both as a clinician and as a researcher. There were stories of the power of gender-affirming care for bringing young people to life and moving towards a hope-filled future. I watched Morgan, a junior in high school, become increasingly confident, extroverted, and then apply for college many states away, much to his mother's chagrin, so that he could ski every day. I watched Chris, a 9th grader, join a new school club for creative arts, and who fell in love with fashion and made a new best friend. I have also witnessed the power of restrictions on gender-affirming care to harm youth and families in this state. Recently, I worked with a family who was recovering from admitting their young person to Children's Hospital when they found a suicide plan. The parents of this young person learned just how hopeless this child felt about their future because, and I quote from this trans young person, "No one believes or cares about trans people anymore." This young person made plain to me what happens when the adults in power start talking and making decisions about the lives of trans people without first trying to understand them and respond to the care they need. I need the trans youth and their families in Missouri to hear me when I say, I believe you, you are loved, I want you here, and I want you alive. In my own research on the impact of the political climate in Missouri on families with trans youth and healthcare providers who care for them, the ripple effect of ongoing restrictions and denial of care is clear. Families and healthcare providers are leaving the state and planning to leave the state because they're scared. Parents are reporting increased hostility being directed at them and their trans kids because of the negative political rhetoric about trans people in this state and now in the nation. I now have 3 years of data documenting the increasing terror, stress, and mental health impact of these restrictions on the lives of Missouri families and providers. Missouri cannot afford to lose more healthcare providers, any more than it can afford to lose good families who are part of our communities and economic success. Missouri is in the top 5 states in the nation for significant shortages of primary care and mental health providers. Who would want to come practice here? Who would want to stay? I ask myself that question. We will all suffer if these kinds of restrictions continue to drive people out of the state. Here's some good news. We don't have to live like this. We can decide not to continue with these kinds of restrictions. We can decide to see the faces of the people harmed in these bills and have them change our minds. I want the Senate and the people of Missouri to see that this is a not yet finished story about the health and safety of trans kids in Missouri. I invite each and every person in this room to join me and others in being a part of a more hope-filled future for our trans youth. Thank you.
Thank you for your testimony. You might have said this, but how long have you been practicing? And you're a family therapist, is that right?
I'm a family therapist. I've been practicing in Missouri for 11 years. I've been practicing since 2009.
2009. So I'm sure probably within the time you've been practicing, but do you know or have any idea when this began with children, this whole thinking, believing that they're born in the wrong body? And
Historians would tell you trans people have always existed.
so since creation, would that be since creation?
I don't know.
Okay.
That's not my area of expertise. The
Well, if the
reading-
therapists say, or the professionals say, historically forever, then that would be from creation, correct?
Again, that's not my area. But what I understand historically and what's been documented in historical records is the existence of trans folks as far back, I guess, as we have history.
So is it your testimony, belief that children under the age of 18 need to have body parts removed and or added?
The WPATH standards for care of trans children who do seek medical intervention do not include surgery as a recommended procedure. Typically, there are phases. There's a social transition that has more to do with how someone appears. And then if the family and the physician and the child, as they move through that process, move on to next stages like puberty blockers and hormones, surgery is not recommended typically until after the age of 18.
Okay, so is your testimony in your belief in counseling families and children that there is sometimes need for puberty blockers?
Yes.
Okay.
I have seen that in my clinical practice, yes.
Thank you for your testimony. Any questions for the witness? Yeah, Senator Hudson.
Thank you, Mr. Chair. Thank you for being here today. Obviously, we're on opposite sides of this issue, but I did want to take this opportunity to have a conversation with you. As an individual that holds the occupation that you indicated you hold, I would imagine, and correct me if I'm wrong, but I would imagine that you agree that there are certain activities and substances that children should not be involved in due to the fact that they have not developed cognitively to realize the long-term effects of that activity or that substance.
I'm not sure what all you're referring to.
Children cannot consent to sexual activity. Children should not be smoking cigarettes. Children, various substances. Would you agree with the statements that I've made?
I think there are some things that we have research to suggest and document are not good for children. Smoking is a good example of that.
And certain other types of activity.
I'm not sure what you're referring to, but I imagine there are things children should not do. I'm a mom, I understand.
There are certain things that, and in those types of situations, it's appropriate for government to get involved, right? We've got certain laws that make it very clear that there are certain substances and activities that children shouldn't be involved in.
I'm sure, yes, I can think of things where that is the case.
So during the time that we were working on the SAFE Act in 2023, it was at that time legal for minors to be exposed to these type of drugs that are currently illegal under the SAFE Act in Missouri. I came across one individual. I spoke with a lot of folks, folks that agreed with me, folks that didn't agree with me. I came across one individual whose child had been on these types of drugs since that child was, I believe, 7, if not 6 years old. That, to me, seems incredibly destructive and inappropriate. Would you agree that that's too young?
I'm not a medical professional, I don't prescribe, so I can't weigh in on that, per se.
But you're here testifying to the fact that you believe the sunset should be allowed to expire so that kids under the age of 18 can have access to these types of drugs, these cross-sex hormones and puberty blockers.
Yes.
But you're unsure as to, you won't state, I guess what I'm trying to get at is, would you agree that there's a line somewhere? That a child is too young to be exposed to these kinds of drugs that can permanently alter their bodies?
Well, I'll tell you what I have learned over the years in working with these families. What I have learned is that each child is different. I have learned that we need to be thoughtful and individualized about the care that we give, that there isn't a blanket uniform way this should go for everybody. I have learned that there are some medical providers who are very well educated and know how to do this well, and others who need to get educated and learn how to do it well. So I guess my answer is it depends on the child and what they need and what the parents decide in that process. There is larger bodies of research. If you look at like the U.S. Trans Survey of 2022, it has 95,000 participants in the study, all trans people, where they ask about receiving medical intervention in adolescence. The regret rate is less than 1%. Over 95,000 participants in the study. And so although I hear stories that have been told today that are regrettable, the truth is the average trans young person who interfaces with a knowledgeable, trained medical professional gets good care and the care they need when met with parents who are also supportive.
So you're opposed to any kind of blanket law that says, at this age, you're too young?
I think it gets away from the kind of individual care that I have seen is needed. And so I think imposing laws that introduce prescriptive restrictions don't allow for individualized care.
So you would be you would not be comfortable making the statement that 6 years old is too young for cross-sex hormones or puberty blockers?
I'm not a medical provider, so I don't prescribe those things. From my experience, each child deserves an individualized plan. I don't know if cross-sex hormones are not prescribed until, from WPATH standards, from what I understand, after a particular age, and it's, I believe it's 12 and up. It's not 6. There might be puberty blockers that are utilized to slow or stop puberty from happening, to hit a pause button. Those are not permanent or cause permanent changes. They allow space for that young person to live, to decide.
Wow. I mean, I apologize. I think I can interrupt you there, but I would disagree with there is a. I have spoken with folks that have been permanently affected by. As a matter of fact, when we were working on the SAFE Act, there was, there are at least 2 components to this legislation. We outlawed the surgeries, and we also outlawed the drugs. And I've spoken to folks that would tell you the drugs have actually been harder on their bodies than the surgeries. But anyway, as I said in the beginning, we're not going to agree on this issue. I just wanted to get a little insight in the way you were thinking. We obviously don't see eye to eye. As a matter of fact, I object to the term gender affirming care. I think that if we really wanted to affirm these kids, we wouldn't tell them they were born in the wrong bodies. But thank you, Mr. Chair.
Thank you, Senator. I did have something else I'd like to ask you. I've been a pastor for nearly 37 years. I've worked with kids, small kids, teenagers, adults. Senator Bratton, he had to leave, but he had a story about his own son thinking he was Batman. Have you had to counsel families, kids that thought they were something other than they were? Like what Senator Bratton said. Like Batman.
Batman?
Yeah.
Not to my memory.
So you've had no dealings with any kids, children, that have thought just that's a fantasy, right? Being Batman. Have you personally, being a family counselor, dealt with any children that had any type of fantasy like what Senator Bratton said?
You mean in play, imaginative play?
Anything like Senator Bratton said, where a child thought they were something other than what they really were?
I'm thinking of the example he gave. I've certainly seen kids have imaginative play. I've seen them imagine out themselves in many different ways. Nothing that reached the level of clinical intervention, except when there was gender dysphoria. Not related to
So
what
how do
he
you
shared.
diagnose gender dysphoria that's different than a child thinking they're Batman or a princess or anything else?
Yeah, there's clinical guidelines for that. So
I'm
we
sure
have
there
the
are.
Diagnostic and Statistical Manual that was created by a team of psychiatrists and mental health professionals. There's scales, measures for that in terms of things you would ask a person. There's an interview guide for the kinds of questions you would ask to understand the kind of distress. Gender dysphoria as an experience is psychological distress about the body and the incongruence between the body and an internal sense of self. So there's clear guidelines and research on how best to do that.
So you just said there, this dysphoria is psychological in nature?
It's
that what you just
psychological
said?
distress about the mismatch between the body and self.
So wouldn't the care be more on a psychological level than chemical or surgical?
Well, psychology is the body. I mean, these aren't separate entities. We live fully embodied lives. I think it's a misnomer to think of our psychology as not our bodies. They are one and the same. I think one place medicine goes wrong often is they dissect people and they remove the body from the mind. And so for any of us, we are often looking for congruency between how I feel and who I am and how I appear and how I show up in the world and what the world feels like to me. And so these aren't separate entities.
Okay, so in your term, your definition of psychology, or that's not just mental. You're
No.
talking about the whole body.
Yes.
Okay. All right. So one last question, and then I'll. Senator Lewis, did you have questions? Let me just ask you one more. So these children that you have dealt with that had these fantasies, like Senator Bratton said, thinking they're Batman or whatever else, how do you counsel them?
I think I said I haven't had necessarily.
Well, I think you did
That's
say you
right.
had some kids that's had those types of thoughts or fantasies. So you've never had in your practice a
they
child.
weren't treatable, in the sense that child imagination and play is a part of development. It's part of how folks come to understand themselves in the world. I had a kid who did a lot of imaginative play, and we have pictures where she looks hilariously ridiculous. But that's part of being a kid. That is quite distinct from when I have a kid come in and is experiencing gender dysphoria and are wondering about gender identity. Those are wildly distinct experiences in the sense that imaginative play for kids is fun and enjoyable. This is not fun or enjoyable, especially as it persists and they have routine experiences of, feeling frankly isolated and alone. So whereas we find Batman fun and hilarious, we do not find folks struggling with gender dysphoria enjoying themselves. So those are, for me, those are wildly different moments.
Okay, so what about little boys that dress up like girls? Little girls that dress up like boys? I've seen it. I've seen it happen a lot.
It happens all the time.
Yeah.
Yeah.
So that's
It's
okay.
part- Yeah.
There's no-
They're playing.
There's no clinical, you just let that happen. Just,
Yeah.
And they do what? Grow out of it?
Sometimes, again, kids play. What we think of as boys' clothes and girls' clothes are very specific to our culture and moment. The clothes we think of as something girls wear, you could go to a different country right now and see a very different experience in terms of wearing a dress, or wearing this hat or that hat, or wearing a hijab or not. And so I think at least what I keep in mind all the time is clothing in and of itself doesn't have to be gendered, except that we do that socially. And so kids play with that. They try and understand it. They figure out what they like or don't like. And some kids try it on, they like it, they don't, they move on, it's other things. And
Okay. I
it's-
appreciate it. Thank you.
Yeah.
Senator Lewis.
You. Good morning.
Morning.
I just want to back up a little bit. I've heard, from several of my colleagues that we just want to keep our kids safe, and I couldn't
Yeah.
agree more.
Totally.
Want to keep our kids safe. What I find very frustrating is that that's not what this is about. If the supermajority was very concerned about keeping our kids safe, we would be dealing with the number one cause of death of our kids, which is firearms. But we're not.
Yeah.
That's not what we're here talking about. In the history, the leading cause of death at one point of our children was car accidents. And we put in place car seat laws to protect our kids.
Yeah.
And today, here we are. I will repeat myself. The leading cause of death of children is firearms. And we're doing nothing to deal with that. So, anyway, just very frustrated with that. But I want to go back to your testimony on, the bill sponsor said that he hasn't spoke with any physicians here in the state of Missouri. I know you're not a physician, but you deal with this type of care. I've talked to many healthcare experts, just in general, a variety of practices, and for several reasons, not just this issue, but several reasons, healthcare providers are leaving the state. They don't want to be mandated. They want to practice according to science, what we've heard about, according to, medical care is fluid. We don't do things the way we did things back in the 80s. Things evolve and change. So could you elaborate a little bit more about the impact the current political climate has on healthcare providers?
Yeah, so we've had 3 years now of surveys. We have about 1,000 people total across the 3 years who've taken part in the surveys. A part of that group is healthcare providers, physicians, nurses, mental health professionals, social workers. But all two of the reports on that are public if folks are interested in looking over them. What providers are sharing in those is what we used a scale in there, a stress scale that has a clinical cutoff. So anyone above this level is considered in a pretty dangerous zone around stress related to their lives or jobs or whatever. And our healthcare providers' stress levels were as high as parents of trans kids in the state of Missouri in terms of how they were feeling about their work and their ability to do it. So we have an incredibly stressed out group of providers and folks trying to figure out how they keep practicing, to your point, ethically, because we have a whole other ethical code that every profession has, and frankly, this law is out of step with that as well. We had providers in the last survey talk about moral injury. What they're referring to is a really personal sort of experience of stress where they're being asked to perform their jobs that are inconsistent with, to your point, science, ethics, but also why they got into this. what was the whole point of medicine, right? What was the whole point of this kind of work? To help people heal, and I'm not given the tools to do that, and I might be threatened with litigation if I try to do something to provide the kind of care that science and my ethics is telling me to provide. And so folks are looking to leave. We had another scale about desire to leave or stay in the state, and people are identifying states they want to move to, and most of them do not have these kinds of bans or restrictions, not just around trans health care, but other things as well.
Right, yeah, absolutely. And I'd love if you would share your data. I think that, I find it beneficial. Also, I think, like when we talk about bans and restrictions with healthcare providers, we've seen over the past few years some of the laws that have passed out of this body where we have physicians calling their attorneys before they're able to treat a patient because they don't want to be, do anything illegal.
Yeah.
So anyway, I think that's it, unless you had anything else you wanted to mention.
Yeah, I want to thank you all for letting me come and testify, and also urge you all to look at larger pieces of data and to really think about what it looks like to free people up to make decisions for themselves and trust our providers and parents to make these decisions. So thank you.
Thank you very much for your testimony. Thanks for taking time out of your day to come. I appreciate it. Next, in opposition. We're going to probably have to shorten the testimony. We're running a little bit late. We're going to have a hard stop here before too long.
Okay, I'll try
Thank
to be
you.
brief. Thank you. I'm Michael Walk from St. Louis County, and I'm here to testify against SB861. 3 years ago, the Missouri legislature passed SB49, the so-called SAFE Act. The law prohibits gender-affirming health care for transgender youth, despite the well-documented benefits of such care. The law is supposed to end after 4 years, but this bill is here to perpetuate the mistake of 2023. My own daughter was troubled and dangerously depressed prior to coming out 5 years ago as the transgender person that she is. At that time, the Washington University Transgender Center was open, and our girl found the help she needed through them. Over the subsequent years, her depression lifted, and she blossomed as the lovely and brilliant young lady that she is. Since the mistake of 2023, such care is no longer available to minor patients. Doctors who have actually studied the science behind diagnosis and treatment of transgender people are no longer allowed to help them. Lawmakers have been more swayed by influencers and lobbyists than by scientists, doctors, parents, and trans people themselves. Many people may not be aware of what this law has done to those most affected by it. Trans people and their families have fled the state to be able to legally access the care they need. People with strong roles in their communities have been uprooted. They no longer live here, work here, or pay taxes here. But those who remain still need this care. As a volunteer leader for Transparent, I have met so many families struggling with trying to meet their kids' needs while living in a state that wants to prevent it. The rhetoric vilifying parents and doctors trying to help their kids is damaging and serves to drive a wedge between these families and the communities that could help them. It has been difficult to watch the legislature ignore the people truly affected by this ban. Paid influencers like Jamie Reed and, yes, Chloe Cole make their money feeding you misinformation about transgender people. The rhetoric from right-wing leaders and media has harmed a very real and actually vulnerable group of Missourians. Please don't be misled by the barrage of misinformation. Gender-affirming care, responsibly administered by careful professionals, helps the young people who need it. This is the 4th year I've come to the Capitol to ask the good people of the Missouri legislature not to do something harmful to transgender Missourians. I come because I have faith in the humanity of the members of this body. I come because I think you understand what it means to be parents, to try to give your kids what they need to live a happy and fulfilled life. Please don't compound the mistake of 2023. Please vote no on this bill.
Thank you for your testimony. Any questions for the witness? Senator Lewis?
Good morning.
Good morning.
Thank you for being here again.
Sure.
Just as you mentioned, your family experience with your child, can you walk through the process of like the deliberate care and kind of walk us through that?
Sure. Unlike many trans kids, our daughter didn't truly understand what was going on with her until she was about 14. She was deeply depressed starting about 2 years before that. And prior to that, she probably, well, she told me that she first decided that she was living as a boy. She decided because of the social stigma of playing with girls that she was no longer going to play with girls when she was in 3rd grade. And that is when she had her first suicidal thought. We didn't realize how bad it was, but when she was 14, she finally, after some months of therapy for depression, psychotherapy, talk, she came out to us by writing a long note to tell us that she was transgender, wanted to be called by a different name. It was a shock. It was not something I ever saw coming, but as a few minutes went by, I realized this explains this and this and this and all these pieces of her childhood that never made sense to me. Why are you a 13-year-old boy who doesn't want to have their baby mural painted over in their room? Why do you cry when we say you're going to grow up and be a man? She didn't even have the understanding internally of how to process that until she was experiencing the strength of gender dysphoria in puberty, in her adolescence. Since then, she transferred to a different psychotherapist who had some experience with gender dysphoria. After many months of that, they put her, it was too late to go on puberty blockers. She was already too far along in puberty, so they put her on testosterone blockers. That immediately had a positive effect. She was able to scale back on the antidepressants that she'd had to be taking. She was able to, over time, it gave her time to stop feeling like all that testosterone was in conflict with who she knew she was in her mind. And yes, the brains of trans people are different from the brains of cisgender people. It's been proven. Where was I? Following some months of this puberty blocker, she went on to hormones, but not without a further pause, because she was afraid to go back to school, having started on estrogen supplements. She was afraid of what her peers would do to her, would say to her. This was not a situation where she was just lightly saying, "Oh yeah, I want to be a girl now." She really was, but she was afraid. So she said, "Please call me by my old name. I'm going to live as a boy." And I understood what that meant. I understood, okay, we'll see where this goes. She got dark. She got severely depressed again. Several months went by, and she finally said, "Look, if people have a problem with me, I have to let it be their problem. It can't be my problem because it's going to tear me apart." So she went back to her blockers. She eventually did start on hormones. Immediately, her depression lifted. She was able to gradually titrate off those antidepressants. And when she graduated from high school, she made the decision that she did not want to go to college in this state because of laws like the so-called SAFE Act, because she could see that that was a wedge in the door that was going to start criminalizing transgender people like her. She was benefited by having this care in her adolescence. It was responsibly administered. There was plenty of time given to look at her situation individually, cared over by actual professionals, and it benefited her. I would hate to know that this state didn't assign any value to that, because to me, my daughter is the world. Apologize for taking so long.
Yeah, no, thank you. And I know it's really difficult to share your personal family story here, so thank you for doing that. I think it's very helpful for us to hear that. And I just want to clarify that surgery was never brought up to your daughter before the age 18, is that correct?
She
By healthcare providers, the
She was,
option?
no.
Okay.
It was very clear that there was no option for any kind of surgery available to her prior to the age of 18.
Okay, thank you.
Yeah.
Thank you for being here.
Sure.
Thank you so much. I appreciate it.
Thank you.
Yeah, thank you. Next in opposition. Thank you all so much for filling out your witness forms, too.
Hello. My name is Samantha Jones. I'm a state worker and a Missouri citizen. I'm intersex and gender nonconforming, and I'm against Senate Bill 861. The language of this bill includes sunsetting the care for children, but it also has the language for adults as well, separating reproductive care from gender-affirming care. This separation is irresponsible and not based in any form of medical fact. The bill lists out a variety of reproductive health care options that are accessed by adults who are cis and intersex, and is trying to say that these options should not be given to transgender people. This is a waste of time, effort, and money. Not only does it separate these surgeries and medications which directly affect the reproductive organs of a person, it also attempts to say that only cis and intersex people are allowed to have these access. It also says that intersex people, including children, should have access to surgeries. This bill language is vague in suggesting that parents and doctors can choose a gender for a child if their genitalia is ambiguous without the consent of the child. If that child becomes an adult and is seeking reproductive care via hormonal or surgical means that is different from their assigned gender at birth, will they be allowed to access it because they are intersex? Or will they be denied that care because they are now considered trans? Adults, cis, trans, and non-binary, have bodily autonomy to decide their care. Teenagers with guidance from their parents and medical providers have the ability to define who they are and how they express their gender and decide on their reproductive health needs. Suggesting that parents and medical professionals can decide the gender of their intersex child before they can consent is a violation of that same autonomy. No corrective surgery should be performed on a child. This is not currently the practice for transgender children, as they are more often prescribed puberty blockers. Why is this being allowed for intersex children? This language and practice denies intersex adults from being able to define and decide their health care. Cis people often receive cross-sex hormones, and these reproductive surgeries for a variety of reasons, as do intersex, non-binary, and cis individuals. If a trans person, adult, elects to have a vasectomy, why should that be classified differently from a cis man or an intersex person when the result is the same? None of these people want to reproduce for their own reasons. Defining this separately is arbitrary based on a single person's opinion and causes more confusion for medical providers, insurance providers, and other personnel, costing a great deal of money and time. As for the language regarding intersex people, most people who are intersex do not find out until they are adults, like me. This bill also suggests that every individual knows their genetic makeup, which is not generally done and is expensive to obtain. And this bill suggests that individuals such as myself must inform our doctors of being intersex or be on the receiving end of discrimination because they are separating gender-affirming care and reproductive health care. Most intersex people are assigned a gender at birth and are raised that gender because their external reproductive organs are not ambiguous, but they have other intersex characteristics, like myself. When it comes to reproductive health care, how would a person who is intersex and assigned birth female receive reproductive care because they identify as a man be classified under this bill? Are they being treated as a trans person seeking gender-affirming care, or are they going to be treated as an intersex person receiving needed reproductive care? This testimony shows that gender-affirming care should not be separated from reproductive health care and shows that the bill sponsors have not considered the repercussions, questions, or ethics of this bill before submitting it for consideration. I urge this legislative body to not pass this bill because of these reasons.
Thank you for your testimony. Appreciate it. Any questions for the witness? Seeing none, thank you very much. Thanks for taking time to come and testify today. Next in opposition. Do we have any more that want to testify in opposition to this bill? Okay, so this will be the last one. Thank you.
Hi, my name is Nicholas Tatum. I go by Verity, and I represent an organization called Intact. We are members of Missouri's intersex, non-binary, and trans community. We and the individuals that we represent today are against Bill SB861. The language in this bill would lead to harm against not only our community, but cisgender individuals as well. This bill does not adequately cover the realities of gender-affirming surgeries, the use of gender-affirming hormone replacement therapy, or puberty blockers. or any other reproductive health care like tubal ligation, uterine ablation, or forms of hormonal birth control like estradiol and PDE5 inhibitors, which are equally affirming to the cisgender, trans, non-binary, and intersex communities. Reproductive health care and gender-affirming care are synonymous. Surgeries and hormones are provided to cisgender individuals under reproductive health care, and yet the same are denied to intersex, non-binary, and trans individuals. This is a grievous form of discrimination. The language of the bill costs the state of Missouri money. Separating reproductive health care from gender-affirming care means that cisgender individuals who need to be prescribed hormones or surgeries will have to jump through extra hoops to get the health care that they need, and it increases the margin of error when insurance companies are billed for procedures and medications, increasing the likelihood that those companies will deny care to cisgender individuals. Denial of care leads to a loss in revenue for the state of Missouri that it cannot afford, whether that denial is against cisgender individuals or trans individuals. Record numbers of LGBTQIA+ individuals no longer feel secure enough in this state to remain due to anti-trans legislation being passed. It has been estimated that this has already cost the state money to the tune of $362 million to $879 million in household income. The following testimony that INTACT presents to this legislative body has been collected from the remaining members of the intersex, non-binary, trans community and our allies. We urge this legislative body to take this matter seriously, to prevent any further loss of state resources, to prevent irreparable damage to the intersex, non-binary, and trans community, and to prevent the continued migration of LGBTQIA+ citizens from the state of Missouri. Thank you for your time.
Thank you so much for your testimony. Any questions? Yes, Senator Nurnberg.
I appreciate your testimony today, and for all who were able to come here to testify. Unfortunately, like many of these senators, were stuck in multiple committees at multiple times, and so I apologize for not being here. But one of the things that you brought up I think is so important, and I know there was a big report that came out over the interim that really speaks to this, and the fact that we are losing Missourians who have been here for sometimes many, many generations because they feel like Missouri is no longer a safe place for them to live and to raise their families, to be able to have the health and the freedom that we all depend on. So I appreciate you bringing those arguments before us today, and I hope this committee and the legislative body will take that with careful consideration moving forward. Appreciate you.
You too.
Thank you very much, and thank you for your testimony. I appreciate it. One last time, anybody here in opposition wants to testify in opposition, testify in support of 861.
Good morning, Mr. Chair, members of the committee. For the record, James Harris, registered lobbyist representing Do No Harm Action. We're a group of medical providers, physicians, nurses, some active, some retired, members of Missouri, here to go on the record in support of repealing the sunset. I suspect on this bill, I won't change anyone's position. I think everyone approaches it from a position of true caring about kids. The one thing I would say, hopefully we can agree on that when we're talking about adolescents, 13, 14, 15, I have two now teenagers, and when we're talking about life-altering decisions, that maybe it's safer, even if you think the majority might agree with something, but even what if there's 5 or 10% of the kids that 5 years later change their mind, the harm that is done to that young person. And it's a life-altering thing. And so hopefully we can pass this and then maybe move forward to helping young people that are confused or young people that need help or are confused. And all of us hopefully work on our rhetoric and stuff so that these young people don't feel not appreciated in society. But I have a 17-year-old daughter, and she's great, and she's so smart. And my wife and I sometimes did the computer and the brain reset? It's human nature, right? My son, I have a 13-year-old, and we know young kids, especially males, their brain's not fully developed. I want to say till it's 18 or 20 now. That we need to put that in perspective. With that, I'm happy to answer any questions.
Thank you for your testimony. Any questions for the witness? Seeing none, thank you very much. Anyone here for informational purposes only? Senator Moon, any closing comments from you? Thank you very much for presenting this bill. We'll move on to Senate Bill 999, sponsored by Senator Hudson. How many here do we have that would like to testify to this bill in opposition? Can I see your hands? In favor? Okay, a few. So we should be able to get through this pretty quick. Senator, whenever you're ready.
Thank you, Mr. Chair. Appreciate this opportunity. For the record, Brad Hudson, Missouri State Senator, District 33, covering Stone, Taney, Douglas, Ozark, Texas, Howell, and Shannon counties, otherwise known as God's country. I am here to present to you Senate Bill 999. This would create the Born Alive Abortion Survivors Protection Act. Under this act, a child born alive during or after an abortion or attempted abortion shall have the same rights, privileges, and immunities as any other person, citizen, and resident of Missouri, including any other live-born child. Any licensed, registered, or certified healthcare provider present at the time a child is born alive during or after an abortion or attempted abortion shall exercise the same degree of professional skill, care, and diligence to preserve the life and health of the child as a reasonably diligent and conscientious provider would render to any other child born alive at the same gestational age, as well as ensure that the child is transported and admitted to a hospital following such care if necessary. In 2024, the American Journal of Obstetrics and Gynecology analyzed 13,777 late-term abortions between 15 and 29 weeks performed in Canada, and found that 11% resulted in live births. Due to gaps in reporting, the number of infants born alive in the United States is unknown, though with a consistent and verifiable failure rate of 0.21% of surgical abortions in Canada when applied to the U.S., that would demonstrate an average of 1,734 infants born alive each year after a surgical abortion. Data from the Centers for Disease Control and Prevention indicates that roughly 1% of all U.S. abortions are carried out or after 21 weeks of gestation, as many as 10,000 late-term abortions per year. Federal law states that all infants who are born alive following an abortion are full people under the law. However, the federal law does not ensure that these infants are given proper medical care, showing the need for this legislation in Missouri. This bill, a similar bill to this, passed the House last year with bipartisan support and passed out of this committee in the Senate before running out of time to be heard on the floor. This legislation is not about abortion, but what should be done after a failed abortive attempt. Regardless of your stance on the practice of abortion, you cannot deny that a baby who is born alive is a human being, a person to be treated with dignity and respect. We must ensure that our laws reflect our values, and children born alive after abortive attempts are given all the care that they deserve. And I'm happy to take any questions if there are any.
Thank you, Senator, for bringing this piece of legislation. I appreciate it very much. Any questions for the Senator? Senator Lewis.
Good morning, Senator.
Good morning.
Excuse me. I just have a question, you gave some numbers of Canada and everything, but I just really don't understand what's happening. I understand. Anyway, I had a constituent come to my office and shared a story about a stillborn child, and that she gave birth, and the medical team, was not viable with life. Wrap the baby up so the family could, just spend a few minutes with the baby, after it was born. So the way I look at this bill, if baby's born and not viable with life, that it seems that your bill is telling the healthcare providers they've got to do everything they can, even if they're not viable with life, to maybe resuscitate or whatever. So is that your intent?
So appreciate that question, Senator. I think it's important to point out the language in the bill. Basically what we're saying here, and the story that you told about the child that was born and was not going to live very long, but during that child's short life, it received as much care and comfort as could be provided to it. What I want to do is make sure that a child that is born alive after an abortion attempt would receive the same amount of care and comfort and everything that can be done for that child during its short life. So this bill deals with situations where there has been an attempt to abort the child, to take the child's life, and that child has survived that attempt. That child should be given every ounce of care, protection, and love possible that any other child would be given.
Okay, thank you for that. And then, do you think, you said it wasn't about abortion, like, this bill in your opening remarks. I do have a question for you, though. Do you think Missourians should be punished for providing abortion care?
I am pro-life. I believe that and know that life begins at conception. Before Amendment 3, I'm talking about the Amendment 3 that passed in 2024. Before that law passed, when I got elected to the legislature in 2018, the first piece of legislation that I spoke in favor of on the House floor was the pro-life legislation that at the time was the boldest piece of pro-life legislation that had been introduced or had been passed in the country. It also contained the trigger to virtually outlaw abortion after Roe v. Wade was overturned. So I made a statement, and since Roe v. Wade's been overturned, unfortunately, Amendment 3 in 2024 passed, and now we have some of the most liberal abortion laws in our Constitution that's in the country, if not the world. I opposed that Amendment 3. While I said this bill is not about abortion, it's not. But if I understood your question correctly, Senator, you're asking my views about life, and I do believe life begins at conception. I am a pro-life legislator.
And I guess not your views about like pro-life, pro-choice, but do you believe that healthcare providers and women who have abortion should be punished?
I have not introduced any legislation that has articulated in a punishment for mothers. I believe that life begins at conception. I believe that the unborn child is a human being that deserves protection under the law.
Okay. Senator, can we look at page 3, sub 4, 5, 6? What are you trying to do with this?
Page 3.
Just from the top, line 48 to like 70.
Okay. Could you read to me,
Yeah.
Senator, because the copy that I have doesn't have the law, or excuse me, the
sure.
bill divided out like that.
It's just knowingly, recklessly. Well, basically, it talks about instrument, device, medicine, drug, substance. I'm just trying to, I don't know what this has to do with any of your remarks about born alive. To me, it looks like it's about the abortion pill or, penalties. So I'm just trying, you're the bill sponsor and just wanting to
Sure.
walk through.
Yeah. No, I appreciate that, and I have been given a copy of the bill now that
Okay.
I
Page 3.
think is printed in the way that yours is now. And you said that at page 3 at the top,
Yep.
yeah, it says knowingly, recklessly, or negligently supplies or makes available any instrument, device, medicine, drug, or any other means or substance for another person to undergo a self-induced abortion or attempted self-induced abortion, or to procure an unlawful abortion or attempted unlawful abortion, or knowingly incites, solicits, or otherwise uses speech or writing as an integral part of the conduct in violation of a valid criminal statute to influence another person. So what we're trying to do with this particular piece of legislation is make sure that we don't have a situation. I want to protect innocent life, and I want to do everything that I can to protect innocent life. And life that is protected under the law should should be, we need to codify in statute that when we have a situation where a child survives an abortion attempt, that child should get every bit of care and life-saving efforts that child is entitled to. That is my desire with this piece of legislation. And is there something that you're concerned about, Senator, that this is not consistent with that?
Yeah, absolutely.
Okay. Well, I am happy to have those conversations with you if you think this bill goes too far. I know that you and I do not see eye to eye when it comes to the issue of abortion. But I think you understand what my desire is and what my intent is with this piece of legislation. I'm happy to have, I would love to be able to have conversations with you about this legislation, get you to a point where you could support it, because I do think this is a bipartisan piece of legislation. I think even, legislators such as you and me that don't see eye to eye on the abortion issue should be able to agree that a child born alive deserves all of the care and protection and everything that we can give that child, that any other child would be afforded.
Well, thank you, Senator. I think that like most of us here, always welcome dialogue and conversation.
Sure.
I think that that's what we do as senators, even if we disagree. So I appreciate your openness and willingness to chat with me.
All right. Always glad to visit.
Thank you. Any other questions? Yes, sure. Senator Nurnberg.
Okay. Good morning, Senator.
Good morning.
As Senator Lewis was asking some questions, it gave me some time to think and kind of how you were responding. And I guess I just want a little bit of clarity from you. I know this is an issue you've worked on for some time, but do you ultimately think that abortion should be illegal?
Yes.
Okay.
Let me make sure that I understand your question.
Do you think abortion should be illegal?
Yes, I believe that the taking of innocent human life should be illegal.
Okay.
And I believe that the child in the womb is an innocent human life.
Okay. Do you think it should be impossible for Missourians to access abortion care?
I think it should be illegal to take an innocent human life, and the child in the womb is an innocent human life.
So you think so the question is, do you think it should be impossible for Missourians to access abortion care?
Well, here's what we can get into, Senator, is some people, they take a very broad definition of what you're calling abortion care.
Okay.
There was nothing in Missouri law that prevented, and you're probably going to disagree with me, Senator, but there's nothing
from leaving the state to access care.
There was nothing in Missouri law before 2024 that prohibited women from getting the health care that they need. The fact that there was an ad campaign that tried to advertise an extreme constitutional amendment as if it were necessary so that women could get the health care that they need, that was false. That was misleading. That was deceptive.
Well, on that, you and I will adamantly disagree.
Yes,
for
we will.
Numerous reasons,
Yes, we will.
right? But just kind of getting back to this bill, one of the things that I think you had said in your opening was this wasn't just about abortion. It was as you used it, the Born Alive Act. However, to me, when I read this, and even looking at and examining parts of the bill, as Senator Lewis had picked out, it does seem that the goal of this legislation is to ensure that we are outlawing all abortion care. And again, going back to penalty provisions for anybody who would help somebody access that care. And that's where I have concern with this bill, Senator, and that's why I would oppose this bill. One of the things that, as I'm looking through this, and all of the very complex situations that do occur, we can probably look at statistics that are drastically different. You shared some data that I've never seen before, and I would love if you would be able to provide that to the committee, the information that you found from Canada.
I'd be happy to.
Yeah, I'd really like to dig into that a little bit more. I think that's important that we are all using the same facts as we try to ascertain our positions on these really complicated matters. But again, when I need information, I go to the experts, right? And one of the things that I think was abundantly clear with the passage of Amendment 3 was that Missourians said loud and clear that they did not want politicians in their doctor's offices, that they had and needed the ability to make those very difficult personal decisions between their families and their providers without the interference of politicians. And once again, what I'm seeing again is that interjection of a politician deciding what is best for somebody's medical care. And, you know, I guess I'll just ask you, Senator, when you need expert medical care or advice, who do you ask, Senator, for that
So
medical expertise?
a couple of things here I'd like to respond to, and I want to get to your question, but one thing I want to respond to is you said that the voters voted, and this is going to paraphrase what you're saying, in Amendment 3, they were making a statement that they didn't want politicians involved in their doctor's
I think
office.
Missourians voted again, and we know it wasn't just us Democrats that voted for Amendment 3. The only reason that Amendment 3 passed was because Republicans and independents voted for Amendment 3. And I think overwhelmingly we saw that Amendment 3 passed because, you know, quite frankly, again, people believe in freedom, in health, and safety. And that's why they voted for Amendment 3.
Senator, the law that we passed when I was here in 2019 was not about politicians in doctors' offices. It was about protecting innocent human life. And I think it's very telling that Amendment 3 just barely passed after the flood of money that was spent advertising it and really pushing a false narrative. But again, you and I could go back and forth on that for
certainly
hours. Your question.
Just the question was, where do you go for medical advice, Senator? When you need medical advice, where do you go?
Not only do I speak to professionals when I'm seeking medical care and medical advice, I speak to professionals when I'm crafting legislation. Now,
So did you have a medical provider, an OBGYN, advise you on this bill?
we haven't. There have been individuals that are connected to the medical community
But
that have
again,
been
I
involved.
would ask for a provider.
I am not going to tell you that for Senate Bill 99 specifically, I sat down with an OBGYN and we went through the bill.
Okay.
What I am,
and again, it's good to know kind of where bills come from, the origin of them.
what I am going to tell you is that Senate Bill 99 is not the beginning of this conversation. There have been legislators that have been working on Born Alive for a long
Sure.
time.
Yep, I saw
There have
that
been a
past
lot of
bills have been
conversations
filed.
that have taken place, and this is a bill that is a result of many conversations, some that I have had and some that others have had as well.
Okay. Thank you, Senator.
Thank you.
Thank you. Thank you, Senator. Thank you. Any testimony in favor?
Good morning, Mr. Chairman, members of the committee. For the record, Susan Klein, representing Missouri Right to Life, here to go on record in support of Senate Bill 999. And we thank Senator Hudson for bringing it forward and standing up for these babies that are born alive. And that we need this legislation because there are many babies that have been born alive after an abortion. Obviously, this issue was brought to light a few years ago with statements made out of Virginia and New York of physicians saying, let's lay the baby aside and decide whether this baby should receive care. Since this woman came in for an abortion, we can't deliver a live baby after this. So that brought obviously concerns in Missouri, in that we don't specifically say in statute that a baby born alive after an abortion needs the same care as any other baby born through the natural birthing process. So we just believe this is good legislation that protects a baby and gives them the same rights as any other baby.
Thank you for your testimony. Any questions for the witness? Seeing none, thank you very much. Next, in favor.
Thank you, Mr. Chairman and members of the committee. Samuel Lee, registered lobbyist with Campaign Life Missouri, to go on record in support of Senate Bill 999. Appreciate the senator for sponsoring this. This bill's been around for at least 7 years, at least since 2019, maybe before. I know former State Senator Bob Onder, a physician, sponsored this. Former State Senator Eric Burleson, Senator Rick Bratton has had this, and of course there's been members on the House, various members in the House have sponsored this as well. First of all, this bill is consistent with what the voters approved in Amendment 3 in 2024. that bill was just not about abortion. But if you were to go to the text of it, you would see that it includes the right on all matters relating to not just abortion, but also childbirth, postpartum care, and respectful birthing conditions. I can't think of anything that is more respectful of a child who is born and that child's parents than to save that child's life, whether that child is born early in pregnancy because of early delivery or because of an attempted abortion where that child was born alive. It is respectful to that child and to those parents of that child to make sure that that child gets the same care as any other child born at that same gestational age. So whatever you think about the old Amendment 3, this is 100% consistent with that constitutional amendment. Senator, to answer your question in terms of the types of care, just imagine it this way. If an EMT were to come to someone's home and a woman delivered early and they called 911, that EMT would provide whatever would be the appropriate care for the child of that gestation. If that woman had a miscarriage or stillborn, whatever is appropriate. If that woman had an abortion where she'd taken abortion pills, let's say ordered on the internet, late in pregnancy, and she delivered a live baby, we expect that EMT to provide that same type of care. Does that mean rushing the baby to the hospital? Maybe yes, maybe no. Would that mean swaddling that child or those children? Certainly. If that means placing that dying child in the hands of mom or dad and that child's siblings, that's what we expect, and that's what this bill does. Secondly, again, Senator, to answer your question, if you're to go back before line 48, and you'll see on lines 46 and 47, we add in this bill, and this has been part of this bill for a number of years, in addition to any criminal or administrative penalties, there's civil liability. So lines 46 and 47, knowingly performs or induces or attempts to perform or induce an unlawful abortion, not a lawful, but an unlawful abortion upon another person. Senators, there's story after story of very evil, bad men who've slipped abortion drugs into women's drinks because they got pregnant and he wanted her to have an abortion and she refused and induced that, including in the second and third trimester of pregnancy, and these children have been born. If that child is born, and again, we're expecting healthcare providers treating that child to provide the proper treatment, we also want to give that woman and that woman's family a right to sue that vile person who would have induced that abortion. And all of those provisions are related to unlawful abortions, self-induced abortions, many of which can occur after fetal viability. And Mr. Chairman, I can go on, but again, we're fully in support of this legislation. And again, thank Senator Hudson for bringing it to your attention.
Yeah, thank you for your testimony. Any questions for the witness? Senator Lewis?
Good morning, Mr. Lee. How are you?
Good morning, Senator. Good to see you again.
Good to see you. I'd be very curious to see the statistics of the numerous cases where men are putting abortion pills in women's drinks to cause abortion.
Sure.
So love that data.
Yeah, and what I find is that it's anecdotal. I'm not aware of a peer-reviewed study because these things are criminal behavior. But I just noticed just the other day, and I'll try to find this and send a link to your office or send an email, that there is some group has put out a map recently of the United States where these incidents have occurred. I remember a case from Missouri. I think there's a Court of Appeals decision of a man giving a woman an insecticide to try to induce an abortion. So we're just not talking about FDA-approved abortion pills. It could be any method that's unlawful. I'll try to find that for you. Whether it's complete or not, I have no idea. But it's an attempt at least to show that this is going on.
Okay, well, then I want to be very careful with what your statement was. So did you just not testify that there are numerous cases of where this is happening?
Yes, that's right,
Based on data that you can or cannot share? Their data is out there?
No. It's based on news stories primarily of men who have been charged with the crime for slipping abortion pills or drugs or something in women's drinks, or other types of attempts, sometimes physical attempts to induce an abortion. I'll be happy to get what I can find, and it's out there. But if there was just one attempt,
Right,
if this
yeah.
just saves one child, Senator, you said earlier, and I agree with you 100% about the previous legislation. We all want to keep our children safe.
Yes,
and I
absolutely.
think that's something we can agree on, and that's what this bill does.
Well, and I think, their current laws, poisoning a woman is illegal. Like
Right,
if they're
but-
putting,
Right, but this gives her a specific cause of action, or if that woman dies. Sometimes not just her unborn child or newly born child dies, the woman can die or be severely injured.
Right.
So if she dies, that would give a specific statutory right for a cause of action for wrongful death.
well, I think there's laws. Anyway,
Well,
there's laws
okay.
already if you poison someone that's illegal.
Okay.
Well, thank you, Senator. Thank you for your
Thank-
testimony. Appreciate it.
Thank you, Mr. Chairman.
Yeah. Any others in support of Senate Bill 999?
Hi there, Jackie Thorstensen. I am an associate of Liberty Link, Missouri, and I'm from Clay County. And I came today to support this bill, Born Alive. I've heard the testimony of Melissa Oden. If you're familiar with her, she has written a couple books and is an abortion survivor, and you can look up the YouTube testimonies that she has. And I just want to simply say I'm in support of this bill and thank Senator Hudson for sponsoring it.
Thank you for your testimony. Any questions for the witness? Seeing none, thank you very much. Did you leave a witness form? Okay, thank you. Any others in support of Senate Bill 999? Seeing none, any in opposition to Senate Bill 999? And seeing none, anybody here for informational purposes only? Seeing none, Senator, any closing comments?
I just want to thank you and the committee for your time today. Thank you.
Yeah, thank you for bringing this legislation. Appreciate it. This now concludes the Committee on Family, Seniors, and Health. Do I get a second on adjournment? Thank you. We are adjourned.